Hello dear friends, I am Dr. Banshi Saboo, Diabetologist based at Ahmedabad near Mumbai. I am currently Secretary for Diabetes India and past President of RSSDI. This is very interesting question that how frequently we write PPI and at a primary care physician across the country with the prescriptions of Metformin and Voglibose in our prescription. I am seeing that many of the doctors they write the PPI is a co-prescription for each and every diabetic patient. So it's very common to write PPI in a person with diabetes. So what I can say, there is a prophylactic uses of PPI also very highly written, and sometimes it is the gastric fullness or there is a complaint related to this. And as we know that in diabetic patients there is a diabetic autonomic dysfunction of stomach, and that could be also the reason for them to have some symptom which may be related to GERD, and that's the reason. So it is a symptomatic prescription also, and at the same time sometimes prophylactic prescription is also written very high. Now, this is a very long-standing question mark for the prescription of PPI on a long term. We all know there is a gut microbiota is very important for metabolic homeostasis. I will not put only on a glucose homeostasis, and for that a healthy gut microbiota is very important. As by prescribing PPI for a long term, definitely there is a disturbance in a gut microbiota, and that may be responsible for increasing metabolic problems. So uses of probiotics in our country is relatively less. It has been used only when someone develops diarrhea, someone develops antibiotic-induced diarrhea. But now we are seeing that more uses of probiotics with the pediatricians colleagues and in our pediatric patients. But I fully agree that there should be more uses of pre and probiotics in our persons with diabetic patients. It is definitely going to help our patients, and there are a lot of data generated in last decade regarding the uses of pre and probiotics in a persons with diabetes, and I fully endorse and agree with that. The uses of pre and probiotics, particularly the patients who are on a long-term PPI in diabetic patients, they should be given for improving their metabolic health and improving their prebiotics, I mean the complete commensals in the GI system.